subject matter of this video.
Hello everyone. You must be wondering who I am and what I am doing here. I am Dr. Insight, the need of the future. I wear many hats. I'm an ophthalmologist, a psychiatrist, a detective, a Sherlock Holmes who never misses a clue, and finally, I'm a healer of the mind. I was born out of growing negative opinion towards refractive surgeries. Series of reports of psychological distress, patients committing suicide, blamed on poor surgical techniques. We may have the best diagnostics, best lasers, and complete mastery of our skill, but still there is an elusive link. We cannot guarantee patient satisfaction.
The Time magazine recently published an editorial on the millennial generation. This latest generation is self-aware, tech-savvy, and have a very different mindset from previous generations.
The problem arises because we as doctors are used to studying the human brain, which we can dissect scientifically. But we need to understanding the human mind. Each person's mental state depends on their beliefs, their experiences. Its dimensions are limitless. Unfortunately, when our inner voice is unhealthy, we no longer maintain a power of reasoning.
So how can we assess the mind objectively?
A quick search online will lead you to iSync Personality Inventory. It consists of yes or no questions and grades of personality based on how extrovert you are, how neurotic you are. It also has questions to give us a falsification score. It does classify a person as sanguine, choleric, megalocolic, or phlegmatic. Of these, unstable and high neurotic scores are usually the ones who come to us perpetually dissatisfied. These patients often present to us with complaints such as ghosting, doubling of objects, ocular discomfort. We use a O3 algorithm where we do a complete ocular examination, detailed optical examination which includes topography, aberrometry, and finally an orthoptic evaluation.
So we asked 250 patients for their post-operative satisfaction. We found that 7 patients were unhappy. Majority had orthoptic imbalance. These patients were also found to have unstable personality types. But what is the connect?
The neurological control of accommodation is influenced by state of mind. The near triad depends on coordination between convergence, lenticular accommodation, and pupil constriction. An imbalance of this often triggers a visual disturbance. This can be detected by instruments to measure real-time accommodation, showing a high baseline accommodation. This is what leads to blur and double vision.
So how can we integrate this into our practice?
Patients who are noticed to display odd or aggressive behavior are asked to fill out a personality questionnaire. We also need to be very vigilant in our observation for clues in patients. We notice how they speak, continuity in their thoughts, the way they dress, the relationship they have with their family members for possible cause of emotional turmoil.
If we observe normal behavior patterns, we can go ahead with surgery hassle-free. But when we observe certain suspicious but not specific signs, we take extra precautions prior to surgery.
But if we observe outright abnormal or red flags behavior, it is better to refer the patient for professional help and defer surgery.
But referring to a psychiatrist can often be a taboo topic.
Be very careful when you use the word mental illness and blame an organic or physical cause. Be sure to have a good psychiatrist with whom you can discuss this case. You also request the patient to come for orthoptic, both home-based and office-based treatment. Let's start off with few cases.
A 27-year-old male underwent successful smile surgery for moderate myopia. 1 year later, he complains of constant discomfort interfering with his work. His topography and ocular examination were normal. but a barometry picked up an accommodation spasm.
If you observe his scans carefully, you will notice an abnormally fluctuating pupil diameter and a consequent unstable refraction. The psychopathic control of pupil response is well established. You should rule out a personality disorder in him.
You're right, Dr. Inside. He had a high neuroticism score and on probing gave history of substance abuse and unnaturally high expectations.
Such patients require professional counseling and gradual de-addiction program for the improving their mental health, and process require patients to have the right effect. Let's discuss one more case to clarify this.
Sure, Dr. Insight. I remember a 28-year-old PhD scholar who wanted LASIK surgery, and as such, she was a viable candidate. But our trained staff noticed some odd behavior in her, and she was extremely irritated about having to wait for any small period of time.
When she met me, she told me sometimes her vision gets blurred when she is stressed, typical of pseudo-accommodative spasm. Surprisingly, her personality type was stable. She confessed she was worried about clearing her exams. My psychiatrist friend explained that every person faces times of temporary stress. We don't need professional help here. However, it is better to defer surgery till acute stress is past.
Thanks, Dr. Inside. This questionnaire helps us predict which patterns can be problematic. It also helps us decide when to take extra precautions before operating, and it prevents us from operating where the patient will never be satisfied.
Another good tool we can use is the pain catastrophizing scale. It helps us assess how a person perceives pain. We can use it for our cataract practice to decide which patients would not be able to tolerate topical anesthesia.
Only if we had known when to be cautious, we could have avoided operating in some patients, which ended up being disasters for both us as doctors and for the patient and their family.
Hey, that's all for now. I'll meet you next year with some more insights into human behavior and mind. But I forgot to tell you something. You don't need me all the time because I'm in you all the time. I'm simply a more wiser, sensitive, and insightful version of you. You have the power to be the same superhero, the insightful doctor in this video.
Any questions? Thank you. It's a very essential presentation in the current day scenario.
Thank you.
Thank you so much.
Thank you.
Doctor,